Straight ahead on Good Morning San Diego, a new trend of inhaling alcohol. Inhaling alcohol, the curb calorie intake has got some doctors worried about this. We're going to talk with one from Tri-City Medical Center to explain what's going on and why it's dangerous. This is an alarming trend going on, a fad, so to speak. Instead of doing shots for a quick buzz, people are inhaling or smoking alcohol fumes to get high while also curbing their calorie intake. It's usually young folks. You can pack on hundreds of calories, of course, indulging in a single drink. So instead of blowing your diet, some have turned to inhaling their spirits instead of swallowing all those calories. That's one purpose. This is YouTube video of some moron doing this. The trend of inhaling alcohol vapors has now, of course, got doctors concerned. Experts are warning that it could be dangerous, even deadly. Joining me this morning with the dangers of inhaling alcohol fumes is Dr. Alfred Joshua. He's emergency medicine physician from Tri-City Medical Center. Good morning to you.
Thank you for having me here.
First of all, we contacted you yesterday to talk about this, but it wasn't the first time you've heard about it. It's been going on.
Yeah, I mean, it's not at the alarming rate that a lot of media have a lot of questions on the topic, but we actually have not been seeing it in the emergency department or as a medical community as much, even though there are concerns. Anecdotally, I've had patients that have come into the emergency department intoxicated or drunk, and then will admit to essentially smoking alcohol when you ask them.
Smoking alcohol is what they're calling it. And we saw the video there of, obviously, first of all, how does that work? How does that get you high or get you that buzz?
So there's actually a number of methods, but essentially smoking alcohol is inhaling the vapors or the fumes of alcohol. So typically people will try to drink it, is what a normal person would do, but these individuals have essentially developed methods in order to make it into vapors. And one of the dangers is when you create it into a vapor, it goes immediately into your bloodstream. So when you typically drink alcohol, it goes through your digestive system, stays in your stomach, gets absorbed through, and essentially goes through your liver, which breaks it down. So there are some protective mechanisms that your body has that if you get too much alcohol, your body tries to get rid of. So typically the first warning symptoms are nausea and then you end up vomiting.
Right.
When you inhale it, those mechanisms to warn you that you're having too much are not there anymore. So it can cause major problems, especially where what we as a medical community are more concerned about, where if somebody starts passing out, their breathing becomes shallow, they stop breathing, they essentially aspirate or vomit into their lungs, the more end spectrum of the effects of alcohol on the body. And that's our concern, that's what potentially can happen with this.
It basically goes straight to your brain instead of going through the regular system.
Yes.
Right? And what you're seeing, it is more adolescence that we're talking about here?
So, as with most things, especially with smoking, there's a lot of people that will experiment, especially in the adolescent and early 20s age. So videos such as on YouTube and other social media sites have popularized some of these methods, and some of the methods are essentially, putting pressurized air into a container with alcohol. Right. There are commercial products out there.
Vaportini, I believe it's called.
Yeah,
right?
that essentially heat alcohol, causing that vapor. And then there's other people that will attempt to put liquor over dry ice and essentially inhale the vapors. So all of these methods, I mean, there's a plethora of all these things that you can see on any YouTube video that shows people, and that's what's dangerous about it, that anyone has access to see this.
You've talked to Poison Control about this. What'd you learn in that
So
direction?
I spoke with Dr. Hurd, of the Executive Director of the California Poison Control Center, and as of to date, there are currently no reportable cases to the Poison Control Center. But it is a question that a lot of people are having about what the dangers and the effects are. So it could be that it's just underreported and patients, when they come into the emergency department, appear intoxicated or drunk, and this is really the method they're using to get drunk.
Is it deadly? Could it kill you?
Yes. I mean, alcohol, if in large consumption, can kill anyone.
Sure.
And that is, again, what some of the dangers are. So typically when you drink alcohol, you know exactly how much you're drinking to some extent because you physically see it. When you inhale it, you really don't have that same way of knowing how much you're inhaling and what level it's affecting your body. So you could go from essentially to a coma state in a very rapid period of time because it gets into your bloodstream and it gets absorbed much more quicker than if you were to drink it.
Could it do permanent damage in any way?
Alcohol over long periods of time could do that. There are currently studies going on. I've spoken with some physicians that are currently conducting studies on the long-term effects of inhaled alcohol. So those things are still pending, but it's always potential.
I would think it doesn't take as much either in this form.
Yes. I mean, it depends on how, again, badly that incident or event happened.
Yeah. But as far as you know, your hospital and some of the other hospitals around town, they haven't actually seen cases come into the emergency rooms with this particular problem.
That needed to be reported to the Poison Control Center. But we would treat this as any patient who came in intoxicated or drunk, and we would take those same treatment measures.
All right, Dr. Joshua, thank you very much for sharing that information with us.
Thank you so much for being here.